the initial assessment looked good. You're right where you should be in your pregnancy. It looks like you've got some good support from your husband here.
Yeah.
So I know that pregnancy can kind of be an overwhelming thing, and especially with your first child, there are just a lot of questions, a lot of uncertainties. So I was wondering if I could help maybe clear up any questions that you guys had, or give you any clarification on anything that you guys would like to know about.
Well, we had been talking about cord blood or cord something. What is that?
Or something.
Okay, that is a question that gets asked a lot. I actually brought some information regarding it that I can give you guys at the end of our session. So yeah, it's definitely something that we want to look at. So we'll start at the beginning. Umbilical cord blood is the blood that is remaining in your baby's umbilical cord after it will be cut from him after the delivery, and it is a source of stem cells. Are you guys familiar with stem cells, what they do?
Not really, no.
Okay, so these stem cells, especially those from your baby's umbilical cord, have the ability to form any type of cell in the body. They're cells that your baby originally started out with that turn him into what he is today.
So what exactly is a cell?
Okay, that's a good question. Our bodies are made up of billions and billions of these little entities called cells, and they're all very differentiated. They have very specific tasks that they do, and they form together to make things like our heart, our brain, our lungs, our liver. Just all the different things in our bodies are made up of these cells, and they all are different, but they work together to perform the functions of our bodies that our body needs.
And what else do these cells do?
They make all sorts of chemicals that our body needs, like insulin, hormones, sugar chains, and they provide for storage and other things like that. They also help destroy things that aren't supposed to be in our body, like disease-causing agents or bacteria. They can help break down some of the bad stuff in our body, like, I don't know, maybe extra alcohol sometimes, or extra medicine, waste, things like that.
Okay. I think we pretty much understand that.
Okay. So good. So let's just say these stem cells from the umbilical cord, and I'm not saying that we've seen anything in the test or the assessment that would indicate this, but if your child were to develop something like type 1 diabetes, these stem cells could be used to help treat and to prevent that from happening. How type 1 diabetes works is the cells in the child's pancreas, they're called the beta cells, and I have to lay your hands. I know that's kind of a lot of information there. But these are in charge of secreting insulin, which helps control our body's blood sugar. And in type 1 diabetes, these cells are not working, and so the insulin is not getting secreted. So as you hear about people with diabetes really struggle with really high levels of high blood sugar, or it's called hyperglycemia. So inserting these stem cells from your child's cord blood into the pancreas would help develop these insulin-secreting cells and therefore control the type 1 diabetes.
So you mentioned diabetes. What other types of diseases can cord blood stem cells treat?
They can be used to help treat a large variety of diseases, and some of them listed here are lymphoma, myelodysplasia, aplastic anemia, hemoglobinopathies, metabolic storage diseases, and immunodeficiencies. So I know those are a lot of really big words, and that can be a lot of medical mumbo-jumbo, but the basic thing that we can get from that is they can treat a very wide variety of diseases and disorders that your child may develop in the future.
Oh.
Well, we've heard about something called bone marrow stem cells. What's the difference between these cord stem cells versus bone marrow stem cells?
Okay, so they can both be used to treat a very wide variety of disorders, but the cord blood stem cells have a definite advantage over the bone marrow stem cells according to many sources, including the ease of collection. There's less risk of complications when the cord blood stem cells are used as opposed to the bone marrow for transplant. And when these are collected, the umbilical cord is cut in the delivery room, like we've kind of talked about, the process of delivery and everything. So the umbilical cord is cut, and then the blood is collected from that, and it's gone through a process called cryopreservation. It's frozen, and this just kind of stops the clock on the aging of the stem cells from the cord blood, and it helps prevent any viruses that might affect the stem cells that we hold in our bodies. These viruses won't affect this cord blood that's cryopreserved. And also the collection of the cord blood is safe, it's painless, and it's really simple.
So how do we bank our baby's cord blood, and where's the best place to do this? That's a lot of money, honey. Yeah.
It can be a pretty hefty fine, and so you can also consider the public banking, which this exists free of charge to those who are willing to donate their baby's cord blood to the public cord blood banking centers. You must register with the collection program by the 34th week of your pregnancy, and you must pass a health history screening. So since you're only having one baby at this time, that's another criteria. You would still be a candidate.
Okay, so the public option is free, you said?
Yes. In most cases, it's free. Sometimes the doctor will charge about a $100 fee, but this is because the cost of storing this blood for the bank is about $1,000 per sample. The National Marrow Donor Program, or NMDP, has matched donors and patients to facilitate the marrow transplants that save lives. Today they are committed to getting samples from cord blood banks around the world to build a strong network and inventory of high-quality cord blood samples that they can use for any patient who needs a transplant.